For a while there, it was really popular in the mental health professions to call explosive kids, that is, kids who have a big temper, whose feelings blow up, who deal with a lot of really intense sadness and anger. It was really popular for a while to call these kids bipolar. And as it turns out, and this has been confirmed by research, it just wasn't true in most cases, which is why we now have the diagnosis known as disruptive mood dysregulation disorder. It's a mouthful. Hello everyone, this is Dr. Brett Pearce, child psychologist, coming at you with another educational video rather. This one is a subscriber request, so shout out to Jennifer for requesting a video on this exact disorder. That is to say, disruptive mood dysregulation disorder. Yeah, I know the current diagnostic system in mental health is a little on the wordy side, if you ask me. So, disruptive mood dysregulation disorder, we're going to call it DMDD for short, is a childhood depressive disorder that was effectively created in the most recent diagnostic system, which came out in about 2013, in order to avoid a lot of confusion that was created surrounding the whole bipolar craze of it was like the 90s or 2000s or something, in which some professionals decided that kids who deal with a lot of explosive tantrums, whose feelings go really easily, that they are bipolar and that they have some sort of rapid cycling type of bipolar disorder. And like myself, there were many professionals who were rather skeptical about this, because effectively what was going on is we were diagnosing a bunch of kids with bipolar or calling them bipolar when they didn't actually have real manic symptoms. And if you at least look at the criteria for bipolar disorder, you will see that you must have manic symptoms in order to be bipolar. Bipolar is not about being sort of fragile. It's not about being dysregulated. It's not about any of those things in terms of what it is diagnostically. It is through and through about, being manic. And you can also be depressed too, but you must certainly be manic. And that's a discussion that's beyond the scope of this video. But apparently there was research done that followed these kids who were being diagnosed with bipolar disorder because they were explosive, not because they actually had manic episodes. And they just failed to find that these kids were actually developing real manic symptoms and thus actually qualified for actual real bipolar disorder later on in life. I don't know. It just seems like it's something that happens in mental health, where you have influential and popular clinicians who sort of create this thing and then they kind of get in their own echo chamber, and it doesn't always end up panning out. And hey, I'm probably as vulnerable to that myself as a practicing child psychologist. So the question, though, that came, and the reason this subject came up is that the subscriber, Jen, asked for me to discuss ways of helping kids who have DMDD. So effectively what we're talking about are kids whose mood is not doing so well and have a tendency to explode a lot. So mostly what we're going to talk about is how to help kids whose feelings blow up really, really, really easily and really struggle a lot with that problem. So the biggest piece of advice that I could give anyone, whether you're a parent or a professional working with a kid who is really, really emotionally dysregulated, whether or not they qualify for a diagnosis of DMDD, is that you just have to work on de-escalation strategies and coping skills for dealing with feelings as a religious right. And in terms of people who are really close to that kid, we have to be coaching them on these things as well as a religious right almost. We have to just understand that this kid, from a psychiatric perspective, is just really, 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 really fragile. And that doesn't mean we don't set limits with the kid. That doesn't mean that we just sort of let the kid do whatever he or she wants. Rather, it means that we just have to understand that we have to use really, really, really carefully phrased and well-crafted strategies for setting limits and helping the kid manage things. So one big example of this would be noticing the things that tend to set the kid off. And so there's a substantial chance that common things that we could get away with 90% of kids, excuse me, been a little sick, I'm feeling better, but little frog in the throat still. So things that would be effective for 90% of kids, or at least you could get away with, like, no, Bobby, I'm sorry, I told you no. Sorry, you're not listening to me. Put the toy away and get over here. It's time for homework. That's perfectly fine for like 90% of kids, but a kid with DMDD, in all likelihood, those are the kind of things that are going to set the kid off. Excuse me. Had to go get some tea. I'm drinking some delicious black currant black tea. It's really yummy. So at any rate, as I was saying, what we have to do is really, really, really be coaching folks on how to use really careful de-escalation strategies with these kids. And we have to be very, very firm and vigorous about that. And the way that I'll try to talk people into this is I will try to say, like, well, okay, let's pretend that this kid had an anaphylactic reaction to peanuts. And let's suppose that his allergy to peanuts was so bad that if there's too much peanut dust in the air, the kid could go into anaphylaxis. You would just have to be really, really, really strict about this. At least for the time being. You'd have to be really, really, really strict, and you couldn't just sort of shrug your shoulders and say, oh, well, I shouldn't have, and you couldn't tell yourself, well, I just shouldn't have to. Most kids don't need me to make sure that there's no peanut products in the house. You couldn't get away with that. I mean, you could should yourself to death, and it wouldn't change anything. And I think that with DMDD, it's very similar. What we find is that folks just have this tendency to be like, well, I shouldn't have to do this, so I'm not going to. And my response to them is like, look, your kid has these horrible, aggressive, explosive tantrums 3 times a day. And if we want to get those down to maybe, no times a day, maybe just a few times a week, which would be a huge change, then we're going to have to be really strict about dealing with things that dysregulate the kid. And this is not me criticizing teachers and parents, but what I very frequently find is that, understandably, the kid's level of problems, the kid's horrible explosive tantrums has really pushed it with other people. And parents and teachers are understandably just beyond their wits' end. And so they're very often responding with a lot of frustration towards the kid. And that just fuels the fire, because as I was saying earlier, the kid has a lot of negative views of self and others, and not a lot of confidence in their ability to succeed because they've got mood problems, right? And those are very common issues with mood problems. And so kiddos' explosions basically are sort of like a way of trying to deal with that in a sense, but then also end up, just contributing to more problems. So it becomes a sort of a vicious cycle. The second big thing that you really need to do is just in the same way that we're being very firm and kind of strict with caregivers and teachers, is that we have to be firm and strict with kid about like being safe and healthy, that is to say, when they're having a tantrum. That's usually a really good starting point, is we can say, look, not in love with the fact that you have these horrible rages, but I get it, you have a lot of anger problems and things have not been feeling good to you for a long time, and that's no fun. And you must be safe and healthy. You can have a big deal if you want. You can have a big, blow up, as long as you're safe and healthy. And so that means things like no threatening, no, threats to hurt yourself, no throwing things, no physical aggression, et cetera, et cetera. And so once we can get the kid to be safe and healthy, at least when they're having an outburst, and once we can get the parents and teachers to show a reasonable amount of effort towards using some meticulous de-escalation strategies, like avoiding saying no, being calm in terms of the body cues and their nonverbal behavior, et cetera, avoiding the use of punishment. Punishments are not going to help a kid with DMDD. In fact, in some cases, with DMDD itself, I'm actually, treating a case of it right now, but with comparable situations where there's a lot of dysregulation, I find that, when I can get folks to just omit the use of punishment, that by itself just has a dramatically positive effect on the kid's ability to succeed, because punishments are highly stressful and they tend to have a negative effect on the kid's mood and self-image, and so that's already going to provide you with a lot of benefit. So at any rate, long of it short, with disruptive mood dysregulation disorder, which actually, it's a controversial diagnosis. I'm actually a big supporter of its creation because I think it really did a good job of capturing something that I was seeing a lot, which is these kids that I would call just depressed, but who had all these explosive tantrums. But I certainly didn't see it as bipolar because there was no actual manic symptoms. Long of it short, I think that DMDD is a good diagnosis. It's a good disorder to have in the DSM-5 because I think it helps to clear up a lot of confusion and avoid the trap of wanting to call people who don't have manic episodes bipolar, which I just think is very confusing and doesn't really fit what bipolar disorder is. So the two big things that you need to do when you're helping kids with DMDD is, number one, you must really work closely with parents and teachers to say, like, let's agree upon a protocol, and it needs to be really strict about avoiding things that trigger the kid, because it's an understandably difficult catch-22 for caregivers, where they can't just let the kid do whatever they want, and they have to help the kid understand that they have to be safe and healthy, but then at the same time the kid tends to explode whenever there's any kind of discipline or any kind of support or redirection that happens. That's a rough spot for caregivers and teachers to be in. It really is a rough spot. The second thing we need to do is we need to get the kid to be safe and healthy. And so I basically don't worry about much of anything else when I'm helping a kiddo with DMDD until I've accomplished that goal, because there's not much else, in my opinion, that can be done until we've got safety established. So I hope this was helpful. Thank you again, Jen, for the subscriber request video. And thank you for the wait. It's been a couple weeks since I've done a video just because I was really quite sick last week, and so I was, barely able to talk as it was. So thank you again. This is Dr. Brett Pearce, child psychologist, signing off, and we'll see you next week for another awesome educational video about kids and mental health.